The cold and flu are debilitating, and one of the worst symptoms is nasal congestion. You can't breathe, your head starts hurting, your voice sounds weird. We want none of that. So what are our best options to clear that congestion? In this video, I'll be going over a bunch of products you can find at your local drugstore and break down which ones work and which ones don't, so you don't waste your money. Okay, so nasal congestion happens usually when you have an infection like a cold or flu. It can also happen when you have allergies, but majority of cases are from a virus. What happens is the tissues inside the nose become swollen and inflamed, and obviously when that inflammation happens, along with increased mucus production, the nose feels congested and not enough air is able to pass through as normal, making it difficult to breathe through your nose. It's important to understand, though, that nasal congestion is usually a secondary symptom to some other cause like allergies or infection, like I mentioned earlier. So that means you can take a decongestant to give you quick relief, but you need to tackle the root cause, like getting your allergies under control or fighting off the infection, or else the congestion will come right back once the medication wears off. First, let's go over natural supplements that can help with congestion. We've all ate something spicy and immediately our nose is runny and completely cleared up. So you can imagine that garlic, onion, and cayenne pepper can help open nasal passages. However, I would never recommend this as an option, as it can do way more harm than good if you snort it or rinse your nose with it in some way. 100% would not recommend this route, so let's just move on. Next is saline nasal spray. This is just salt water solution in a bottle that you can spray up your nose. You can also get a saline solution in a neti pot and rinse your nose that way too instead of using the spray. The salt water helps moisten the mucus and can soften it so that air can more easily pass through. It doesn't really do anything for inflammation, so it can help temporarily or a little bit, but most of the nasal congestion occurs because of that inflammation I spoke about earlier, so we need to reduce that swelling. The good thing about saline nasal spray is that it can be used safely every single day. There's no real risk to using it daily, which is the biggest advantage of this option. There's also peppermint and eucalyptus, which is what is found in Vicks Vapor Rub, and this is mostly used as a cough suppressant and pain reliever, but it can also help with reducing congestion. I would not really consider this as an option for nasal decongestion, as that is not the main purpose of using this product. Okay, let's move on to some stuff that works a little bit better than everything mentioned previously. In terms of over-the-counter non-prescription decongestants, there are two types: oral and intranasal. First, we'll discuss intranasal. The most popular option is Afrin. The ingredient in Afrin is oxymetazoline. Always buy the generic store brand to save money. There's no difference. Just make sure it lists oxymetazoline as its active ingredient. 2 to 3 sprays per nostril every 12 hours as needed. This is a pretty effective nasal decongestant. However, it cannot be used for more than 3 days in a row. This is very important, since using it more than 3 days can cause the congestion to come back with a vengeance. Even worse than before once you stop the nasal spray. Another option is phenylephrine nose spray, 2 to 3 sprays per nostril every 4 hours as needed. This is inferior to oxymetazoline, so I don't normally recommend this. I stick with recommending oxymetazoline when a patient is asking for a nasal spray decongestant. Again, do not use for more than 3 days. That's why I said the advantage of the saline spray was that it is safe to use daily. You don't want to rely on oxymetazoline, as the congestion will always come back stronger once you stop using the spray. Okay, so that was intranasal. Now let's talk about oral decongestants. There's only one option you should consider, and that is Sudafed. However, there is some confusion on the kind of Sudafed. There is Sudafed PE and Sudafed. One of these is absolutely useless, and the other is God's gift to nasal congestion. Why they have the same name but opposite efficacy, I have no idea, but let me break it down. Sudafed PE is phenylephrine. This one is useless. Never buy it. It has extremely poor oral absorption, and although it is safe, it's not effective. In fact, most drugstores have removed phenylephrine from their shelves completely, since the FDA basically has said throw it out, it sucks. You'll mostly only see it in combination products like Dayquil, which is another garbage product in its own right, but that's for another video. Now, the particular Sudafed that you want is the one that contains pseudoephedrine, not phenylephrine. Very important to notice that difference. This one you have to ask for at the pharmacy counter. It will not be sitting in the aisles. They'll make you hand over your driver's license because they limit how much you can buy at a time. This is very effective. It will clear those sinuses up within 30 minutes, and depending on the dose, it can last all day. It comes in a 4-hour, 12-hour, and 24-hour dose, depending on which one you want. Now, although pseudoephedrine is extremely effective, it also has some side effects to be aware of. It will increase blood pressure and cause insomnia if taken close to bedtime. One last thing I'll just mention is you should not take these within 14 days of a medication drug class called MAO inhibitors, but unless your doctor is 4,000 years old, there's almost no chance you're on one of these medications, but I've listed them here just in case. Normally at this time of the video, I would go over prescription options, but there are none. They are all available over the counter, and that's a good thing because that means you don't have to go to the urgent care or make an appointment with your doctor just to get a nasal decongestion. It's very simple. As long as you follow the directions on the back, it is safe and effective. Okay, so here are my recommendations as a pharmacist for nasal decongestion, although you personally should always consult with your own personal healthcare provider like a pharmacist or doctor to get your personal recommendation. The best option without a doubt is pseudoephedrine. It is the most effective and works every time. However, if you have high blood pressure or heart problems or need to sleep soon, then a nasal spray that contains oxymetazoline is the best alternative. Both the oral and nasal spray should not be used for too many consecutive days, as that is not their purpose. They are for short-term use only. If you need long-term use, then consider using a saline spray or saline solution in a neti pot, as that is the best and safest option long-term. That's it for this video. Thanks for watching.